So, welcome back. Now we are starting with head, neck, face portion, okay, and neuroanatomy. Today is your first osteology class in this section. We will be reading about the atypical cervical vertebrae. As usual, I will show you some pictures. You have to just correlate. I'm sure you will be able to correlate everything. I will be naming some muscles. You may not understand about the muscles now because once the theory part is covered or the dissection part is over, then you will be able to understand everything. Okay, first try to identify the parts with me. In atypical cervical vertebrae, there are three bones, three vertebrae. First one, C1, C2, and C7. No need to write anything just because you have another class today, right? Histology class will be there. So whenever I tell you to click pictures, just click pictures, and if I tell you people to write down anything, just write that part only. No need to write everything. Okay. First we will see the parts, then the important attachments. Okay. First we will start with C1. C1 that is cervical, first cervical vertebrae. It is also known as, do you know what is it called? It is known as Atlas. Why so? Why is it known as Atlas? Atlas पता है किसी को? According to mythology, Greek mythology, Atlas is the god who carries the earth globe. Exactly the globe of our head. It is carried by C1. That's why it is also known as Atlas. C1 cervical vertebrae. Okay. See, these are the parts. If you can, please draw a freehand diagram. If you can't, then just take a picture. This one is taken from I.B. Singh. Okay, the textbook of I.B. Singh, Dr. I.B. Singh. Okay, what are the parts? First, look at this picture, then I will show you the bone. What are the parts? This one is, what is this one? Facet for occipital condyle. Occiput कहाँ पर है? ऊपर. Right. This is your facet for, what is this? Facet for dens. Dens कौन से bone पे है? Dens is a part of C2. That is axis, also known as odontoid process. This is your anteriorly placed elevation, that is also known as anterior tubercle. This one is known as posterior tubercle. Posterior tubercle. This one is group for vertebral artery. वहाँ से क्या जाएगा? Vertebral artery, obviously, right? This is the group for vertebral artery. This is vertebral foramen. What is this? Foramen transversarium. And this is your transverse. This is your transverse process. And if you look at the bone from below, नीचे से देखोगे तो फिर what are these two things? These are facet for this won't be atlas, this will be axis. This is your, what is this? Again, these are foramen transversarium. This is your anterior tubercle and this is your posterior tubercle. So this is your C1 cervical vertebra. C1 cervical vertebra. What are the parts? What are these two things? Transverse process. And this one? Foramen transversarium. What is this thing? Anterior tubercle. And this is posterior tubercle. This is group for vertebral artery. This is vertebral foramen. Vertebral. What is this thing? What is this thing? Look at the picture. What is this thing? This is facet for Facet for dense. See, what's the shape? Obviously you can see. This is ring shaped, ring shaped. Right and left lateral mass is connected by a short anterior arch. सामने की तरफ क्या है? These are two lateral masses. These are connected anteriorly by anterior arch, posteriorly by posterior. Right and left transverse processes. I have shown you, right? What's the features? Does it have any body? Does it have vertebral body? No. Absence of body. And then, is there any spine? There is no spinous process. Absence of spine. Transverse process. These are the long transverse processes. Okay. Then, superior articular facet. What are the superior articular facet? These are the superior articular facet. What's the shape? These are concave in shape. Concave. नीचे है. These are inferior articular facet. What's the shape? You can see these are round. Okay. Superior articular facet are concave and elongated. They are kidney shaped. And the inferior articular facets are more or less circular. It is directed downwards, medially and backwards to articular with the corresponding facet of the axis vertebra. नीचे की तरफ कौन सा होगा? If these are the superior inferior articular facet, तो नीचे का कौन सा बोन है? नीचे कौन सा बोन है? C2, that is axis. Axis आके लगेगा. That's why the inferior articular facets are more or less circular. It is directed downwards, medially and backwards to articulate with the corresponding facet of the axis vertebra to form the which joint? Atlas नीचे है axis. This will be atlanto-axial joint. Atlanto-axial joint. ऊपर the superior articular facet are concave and elongated. They are kidney shaped. Direction directed upward and medially to articulate with the corresponding condyle of the occipital bone. Which joint? ऊपर है occiput, नीचे है atlas. Atlanto-occipital joint. ऊपर है atlas, नीचे है axis. Which joint? Atlanto-axial joint. Atlanto-axial joint. ठीक है. Superior articular facet पे कौन सा joint होगा? Which joint is formed in superior articular facet? ऊपर है occiput. Atlanto-occipital joint. और inferior articular facet में Atlanto-axial joint. The medial surface of the lateral mass is marked by a small tubercle, roughened tubercle. कौन सा attachment होता है? Transverse ligament of the atlas is attached here. See, if you look from these are the rough tubercles. These are the rough tubercles. Attachment is कौन सा structure का लगता है यहाँ पर? Which ligament? Transverse ligament. नीचे से देखोगे तो फिर ये नहीं दिखेगा. If you look from the above, you will see able to see. These are the rough elevations or tubercles. Attachment is transverse ligament of the atlas. The transverse process is project laterally from the lateral masses. Obviously, these are the transverse processes. They project बाहर की तरफ, right? Laterally from the lateral mass. ठीक है? Now the attachments. Click a picture of this one. Click a picture of this one. See, just revise the various parts with me first. This one was, what was it? Anterior tubercle. This was posterior tubercle. This one was transverse process. This one was transverse foramen transverse. This one is, what was it? What was it? Facet for dense. And this one was, this was superior articular facet. Okay. Now the attachments. Just know the parts and what are the adjacent structures seen in this picture. This one was transverse process. Along the transverse process, what are the structures present? You can see 4 muscles. What are those? First one is First one is rectus, capitis, anterior. Then rectus, capitis, lateralis. Then levator, scapulae. And then comes the oblique capitis superior. Oblique capitis superior. Just you have to know the orientation. Is this one anterior or this one anterior? Anterior कौन सा है? This one is anterior, right? Just you have to know the orientation, anterior to posterior. First one is rectus capitis anterior, then rectus capitis lateralis, levator scapulae, and then comes oblique capitis superior. Oblique capitis superior. Now along the adjacent to the posterior tubercle, what are the structures present? What are the structures? Ligamentum, okay, and then rectus capitis posterior minor. You may not be able to understand all the muscles, and just you have to wait for the dissection or theory portion. Okay, just remember the names. Along the transverse process, there are these four structures, and along the posterior tubercle, there are these two structures. See, here, I told you, right? This was the group for vertebral artery. And which structure is present here? Vertebral artery. And just below the vertebral artery, there is, what is this thing? Fast spinal nerve, which gets divided into anterior primary rami and posterior primary ramus. Anterior primary ramus and posterior ramus. And these are the elevations in the medial wall of the lateral mass. These are the elevations. वहाँ पर कौन सा attachment था? पहले पढ़ाया था ना? The medial surface of the lateral mass is marked by a small roughened tubercle to provide attachment to the transverse ligament of the atlas. So this is the transverse ligament of the atlas. Exactly whatever is what I have shown you here is written in this slide. Okay, the vertebral artery passes upwards through the foramen transversarium and then runs medially on the groove over the posterior arch. Okay, then the fast cervical nerve crosses the posterior arch deep to the vertebral artery and divides here into anterior and posterior primary rami. The fast cervical nerve, this one, first cervical nerve, this one divides into posterior primary ramus and anterior primary ramus. Okay. Structure passing through the vertebral canal. Write it down. This will be asked. This is the vertebral canal, right? See, this is the vertebral canal. What are the structures passing through the vertebral canal? Meninges, spinal part of the accessory nerve, and the anterior and posterior spinal arteries. Anterior and posterior spinal arteries. Meninges and the spinal part of the accessory nerve. It can be asked in MCQ as well. Which of the following structure doesn't pass through the vertebral foramen of C1? See, the vertebral artery, it is accompanied by vertebral vein and a plexus of sympathetic nerve fiber as well. Vertebral artery, it is accompanied by vertebral vein and a plexus of sympathetic nerve fiber as well. The transverse ligament is attached to the medial side of the lateral mass. The ligamentum is attached to the tip of the posterior tubercle. This one, tip of the posterior tubercle, right? And these are the muscles. I have already explained. What are the muscles? See, along the transverse process, rectus capitis anterior, rectus capitis lateralis, levator scapulae, and oblique capitis superior. See, rectus capitis posterior minor arises from the posterior tubercle. Oblique capitis superior arises from the posterior part of the upper surface of transverse process. Rectus capitis lateralis arises from the anterior part of the upper surface of the transverse process. But the inferior part, the oblique capitis inferior, this one comes from the inferior aspect of the transverse process. मतलब transverse process के नीचे की तरफ से, right? Inferior aspect of the transverse process. Just you have to know this picture. Have you taken picture of this one? Just you have to follow this, and you have to know the orientation anterior to posterior. Then you will be able to. This is the superior part, right? seen from above. You have to know the orientation, anterior to posterior, then you will be able to name everything. Then, adjacent to the posterior tubercle, which muscle is present? Rectus capitis, posterior minor. Rectus capitis, posterior minor. The rectus capitis, posterior minor arises from the posterior tubercle. Posterior tubercle. Okay? And from the anterior tubercle, this is your anterior tubercle, right? Which muscle is present here? Attachment of longus scoli. See, some fibers of the upper oblique part of the longus scoli are inserted on the anterior tubercle. Just whatever I have shown you in this picture, this is exactly what is written here. Okay, so in this bone you have to first just know this picture and this picture, then everything is done. Then comes the C2. Achha, first let me show you the parts again. Obviously this was the, just correlate to the picture. This was the, which process? Lateral mass. They attach, fuse anteriorly. This one is anterior tubercle. This one is posterior tubercle. This one is superior articular facet for which joint? It forms which joint? Occipito-atlanto-occipital joint. This one is inferior articular facet. Forms which joint? Atlanto-axial joint. These two are transverse process, and this foramen, these are, yes, and this is the group for vertebral artery. Group for vertebral artery. And what is this thing? Facet for dense. Facet for dense. This is the rough tubercle. Which attachment is present there? Which structure is present here? Transverse ligament of atlas. So this is the dense part. This is the dense. Okay. This is the dense of axis or C2. This one is attached here. दोनों एक, I can show you properly, but ऐसे लगता है दोनों. Okay. ऐसे लगता है. That's why this is the facet for dense. Dense आके यहाँ पर लगता है. ठीक है? It acts as an axis. Okay. That's why it is also known as C2 vertebra is also known as axis. Axis. See, presence of odontoid process. See, this is the dense. This one is the facet for anterior arch of atlas. Obviously, right? Anterior arch आके यहाँ पर आके dense लगेगा. ठीक है? Facet for, these two are the facet for which joint? Which bone? Which bone? ऊपर की तरफ कौन सा bone होता है? Atlas. It forms which joint? Atlanto-axial joint. Atlanto-axial joint. And these are the, see, no, these are not the transverse process. These are the transverse process. This is your inferior articular facet. Inferior articular facet. See, this small part, this is the body. See, this is your transverse process. This is your dense or odontoid process. This is your, what is this? Superior facet, right? Facet for atlas. These are inferior articular facet. Okay, this is your body, and this is the dense or odontoid process, right? See, take a picture of this one. See, read it with me. What is this thing? What is this thing? This is dense. This one is facet for atlas. This one is also facet for atlas. These are transverse process. This foramen is foramen transversarium. What is this thing? Vertebral foramen. And this is your spine. Spine was absent in C1. This part is, these two are lamina, and this is your pedicle, and this is the body. In case of a fracture in this thing, pedicle here, this is also known as hangman's fracture. Hangman's fracture, because in case of judicial hanging मतलब लीगल हैंगिंग कहाँ पर होता है? कैपिटल पनिशमेंट के टाइम पर जब जुडिशियल हैंगिंग होता है, दिस इज द एरिया वेयर फ्रैक्चर हैपेंस. ओके, इट विल बी टॉट इन डिटेल्स इन फॉरेंसिक. दिस इज ऑल्सो नोन एज हैंगमैन्स फ्रैक्चर. ठीक है. नाउ द अटैचमेंट्स. क्लिक ए पिक्चर. Everything has been written. If you need the slides, you can take it from me. Just correlate with the picture. It is also taken from the textbook of Dr. I.V. Singh. Okay. This is your dents. What are the structure attached to dents? What are the structures attached to dents? This one is apical ligament. Apical ligament. और साथ में alar ligament. Apical ligament and alar ligament. What are the muscle attached to the or adjacent to the transverse process? What are the muscles? Look at the picture and tell me. Levator, scapulae, and then splenius, cervicis. Splenius, cervicis, and levator, scapulae. And then which muscle is present here? Semispinalis, cervicis. And adjacent to the, which part is this? Spine. Spine. Adjacent to the spine, what are the muscles present? This one is ligamentum. Okay. And this muscle, this one is the muscle. Which muscle is this? Rectus capitis, posterior major. And this one is oblique capitis, inferior. And in the posterior portion of the, this is the body, right? In the posterior portion of the body, there is membrana tectoria. There is membrana tectoria present in the posterior portion of the body, right? The lower end of membrana tectoria is attached to the posterior surface of the body. The ligamentum nuchae is attached to the tip of the spine. Tip of the spine. And the right and left alar ligaments are attached to the dents. Right and left alar ligament. यहाँ पर होता है, यहाँ पर होता है. And there is the apical ligament is attached to the apex of the dents. ठीक है? Apex of the dents. The rectus capitis posterior major arises from the thick posterior edge of the spine. Everything has been shown in this picture. Okay, these are the major attachments. You have to know about all these things. You have to show the attachments. Okay, there are some other muscles as well, not seen in the picture, not shown in the picture. Just write it down. It's not present in the picture. You have to write it down. The vertical part of the longus scoli is attached to the anterior aspect of the body. The vertical part of the longus scoli is attached to the anterior aspect of the body. The scalenus medius arises from the anterior aspect of the transverse process. Transverse process. Other muscles attached to the spine are multifidus, interspinalis, and spinalis cervicis. Multifidus, spinalis cervicis, and interspinalis. See, if this is these are the transverse process. Is it big or small? The transverse process is big or small? Small. This bone has odontoid process. These are the special features of C2 or axis. See, there is presence of odontoid process and transverse process are small. सामने कोई anterior tubercle, is there any anterior tubercle? No, there is no anterior tubercle. यहाँ पर था, right? There was this anterior tubercle, not present in the axis. Okay. Anterior margin of the inferior surface of the body projects downward to a considerable extent. This one, what is the direction of foramen transversorium? This is directed superolaterally. In case of typical vertebrae, it is directed vertically. Okay. In this bone, this is directed superolaterally. Inferior surface presents a deep and wide inferior vertebral notch placed in front of the inferior articular process. Okay. The superior vertebral notch is shallow and present behind the superior articular process. Okay. Inferior surface presents a deep and wide inferior vertebral notch placed in front of the inferior articular process. And the superior vertebral notch is shallow and present behind the superior articular process. These are the features, special features of C2. The spine is, see, this is the spine. देखो सामने पीछे की तरफ क्या है, डिवाइडेड इनटू टू, राइट? लगता है ना ऐसा, दो पार्ट हैं. This is known as, what is this? The tib is bifid. The spine is massive, that is large, thick and very strong and deeply grooved inferiorly, also known as, this is bifid. And the lamina are thick and strong. Which part is lamina? This is your lamina. See, these are the lamina. And this is your, what are these two parts? Pedicle. The fracture of this part is known as hangman's fracture. Hangman's fracture happens in case of judicial hanging. Judicial hanging. Okay? Now the C7. C7. Take a picture. Please take a picture of this one. Again, all the parts are same only. This one is, what is this part? Body of the vertebra. This is vertebral foramen. This part, lamina. Right? This is superior articular facet. These are transverse process, right? Transverse process. Foramen is foramen transversorium. And this one is posterior tubercle. This one is anterior tubercle. Can you tell me the difference? Any difference from C1 and C2 that you can see here? Spine is very long. That's why C7 vertebra is also known as vertebra prominence, because the spinous process is very prominent and long. Okay, also known as vertebra prominence. Okay, what are the parts? This is body, right? This is spine. What is this thing? This is nothing. But this one is for making joints and all. जो specimen बनाया था ना तब इसके लिए है. This is nothing. Example ये दे दिया और फिर पूछा what is this? Don't say this is a foramen. These are the foramens. These are the foramens. This is obviously the transverse process. Anteriorly present, anterior tubercle. Posteriorly present, posterior tubercle. This one is superior articular facet. And this one is vertebral foramen. And this is a long spine or spinous process. That's why it is also known as vertebra prominence, because of this long prominent spine. Okay? Spine is strong, long and non-bifid. Which one was bifid? C2. This one is not bifid. Transverse process is relatively long and lacks the remove it. No need to write this one. Just write transverse process is relatively long. Transverse process is relatively long. Transverse process is relatively long, and foramen transversarium is relatively small and does not transmit the vertebral artery. It transmits only the accessory vertebral vein. It doesn't transmit the vertebral artery. It transmits only accessory vertebral vein. There is something known as occipitalization of atlas. This is something of clinical word. Occipitalization of atlas. Occipitalization matlab which bone here? Occiput and atlas. The congenital fusion of ring of the atlas vertebra to the base of the occiput. This one, this ring, it gets fused with the base of the occiput. Okay? This is known as occipitalization of atlas. It is one of the most commonest abnormality of the upper cervical vertebra. Okay? This is one of the commonest abnormality of the upper cervical vertebra. Okay? Done. This much. Is everything alright? Have you people seen it? I am giving you the bones. Please divide among yourself and see. If you find any difficulty, you can ask me. Okay? अगर आज ना हो किसी और दिन भी पूछ सकते हो. No difficulty. Come. तीनोटा कलेक्ट करा আমাকে দিয়ে যাবে আবার. ঠিক আছে? Now after that there will be histology class.